We have to be affecting change. We have to be engaging and using voices. But the only way we can do that is if we're still around to do it. And so both of these things are true. It's true that we need big changes. It's true that the system is contributing to burnout. And it's true that we have to find a way to live in the meantime. And we have to find a way, because also life doesn't stop. Hello, welcome to the Integrated Care Podcast from the Collaborative Family Healthcare Association. I am the production editor, Grace Pratt, and I'm joined by several of my co-hosts today. We are going to come to you with a topic that I was sure that we'd talked about before, and this time I was right. Usually I say that, and I'm like, I'm sure we've talked about this before, and I look through, and we haven't, but it's been a minute. We'll get into that in a minute. But first, I'm going to start the way we always do with our icebreaker question of the month. One of my residents asked me this question. I have residents on rotation with me for behavioral medicine this month, and I try to start them with an icebreaker kind of question like we do from the podcast. And usually I borrow podcast questions for them, but I'm going to go the other way this way. He asked a great question. He said, what is an activity or a way you pass time that you just associate with just like pure joy and pleasure? Just something that is really lovely and happy for you. So going around the circle from my perspective on our Zoom window today, first we have Neftali Serrano.
Hey everybody, I am Neftali Serrano or Neftali Serrano, whichever way you're able to say it. And I think the thing that I certainly associate with just feeling good is swimming. In fact, I'm going swimming today. Our neighborhood pool doesn't open for a couple of weeks, but I'm going to go to an indoor pool, which is not as fun. But there's something about just being in water. I love water. I'm half Puerto Rican and half Colombian, and both my parents were born near water. And it just has always been a thing. I love water. So being in the water and then just gliding through the water. And it's amazing how I can get into sort of a meditative state when I'm in there, and just kind of keep going and going. In fact, sometimes I have to just monitor myself because I'll be exhausted at the end and not realize it. So I don't know. There's just something about that feeling that is sort of inexplicable.
I love that. Have you been a swimmer your whole life?
No, that's the funny thing. I am a self-taught swimmer. We lived in New York City, which was near the beach, but we actually didn't go near the beach. I go to the beach for some reason, and the beach is not a great place to learn how to swim. So yeah, I just picked it up as an adult when my kids started doing competitive swimming, and I was like, hey, that looks like fun. So yeah.
And then would you circle back and introduce yourself just in case we have new listeners who don't know who you are?
Oh, yes. Something like that. Yeah, just jumped in, of course. Yeah, so I'm the CEO of the Collaborative Family Healthcare Association that sponsors this podcast. And our mission is a very simple mission. I still have not met anyone in the world who disagrees with our mission or thinks it's a bad idea. So if you're one of those people, write in and let me know why you might think it was a bad idea. But we exist to support the integration of physical and behavioral health in the health system. We think people should be cared for as whole people.
Thank you. We also have Jen Thomas.
Okay, great. Jen Thomas, family medicine, addiction medicine, Morris Hospital, and co-medical director at CFHA with Laura Sideri the past year. So my answer, can I kind of like cheat and halfway answer?
Absolutely.
So I am actually a new swimming student. So I am learning with a coach, and it is humbling. So I would like to say, Neftali, that, it's my joyful place. I'm still in the beginner stage, like the training wheel, clunky. I think I'm not drowning, but like my body's like panicky and stuff. And so it's really been an interesting thing to like learn something new as an adult, but actually really empowering because I haven't like learned something new. I've been looking for some kind of like activity or like being physical thing for a while. And I like it. And it's been challenging to like do that, and the the humility of like, sitting on the side with all the little kids and like 44-year-old lady jumping in the pool. And true to form, I almost vagaled my second lesson and like crawled out of the pool and threw up. So it's like, well, Jill, she's my coach. She's like in her 60s. She's like, hey, but if you keep coming back, what else could, can't get worse from there. Yeah, no, but I was inspired. My little sister Jackie is also nearly self-taught or learning, and she's like, I'm gonna try to do a triathlon someday. And I was like, good for you. So I guess I'm kind of on little sister's coattails with this, like, hey, good for you. What a good example. You're exercising and stepping outside the comfort zone. So here I am, early stages, awkward, figuring it out, just like other things in life, right?
Mm-hmm.
Yeah, that's me.
Thank you, Jen.
Yeah.
And I'm Grace Pratt. I am the behavioral medicine faculty at Great Plains Family Medicine Residency Program in Oklahoma City, Oklahoma. And to me, pure joy, water related for me too, except I just want to be like next to the water. Put me under an umbrella
That works
at the
too. I'm into that too.
with a book.
Yeah.
Let the waves go, and under an umbrella because I need the shade. There's a lot of burning that can happen here.
What are you doing in Oklahoma?
Well, right. Listen, it's very landlocked. So it's not an activity I get to do a lot of times. So I do have like a secondary because that is my ultimate, like if I can just spend the afternoon listening to the waves, yes. But I also really like to just lay in the hammock. Like let there be a cool breeze. Again, sometimes with a book, sometimes with a nap, and just enjoy the nice weather, which also is kind of what am I doing in Oklahoma? Because we get like, a little sliver of time in the spring in between tornadoes that we're able to have nice weather and a little sliver of time in the fall, but it's okay. I think that being outside and being near water and being in nature, there's a reason that's a theme for us, isn't it? And the groundingness of all of that. Well, I want to get into our topic today, which is related to all of that, about well-being and burnout and well clinicians and well teams and what does that look like? But first, Neftali, do we have any news and notes to review?
Yeah, first news is a thank you. It's just thank you to everyone who blew us out of the water in terms of submissions for our fall conference. For those of you who've been listening, you know that we have a fall conference every year. And this year it's going to be in Raleigh, North Carolina, not too far from where I am here in Chapel Hill. And we had, I think, around 250 submissions this year, which is close to over 100 submissions more than we usually have, which always bodes well for an exciting conference with the best sessions, with great people, which is what a conference is really about. So thank you to everyone, and start marking your calendars. If you want to find out more information, dates and all that, in October this year, you can go to integratedcareconference.com. And the other thing is, if you've been a listener for a while but haven't joined, we just have so many people doing great things in these small groups. Jen and Laura, our medical directors, are hosting a MCHIC, they're calling their Medical Champions of Integrated Care group. So if you're in the medical side of things, trying to champion integrated care, there's not a better community to connect yourself with. We've got all sorts of other groups. We've got folks in family medicine residency, just like you, Grace, meeting together and providing peer support, trying to figure out the new landscape of what it means to work in family medicine as a behavioral health provider. And any number of slew of other groups. There's dozens of groups at this point. So it just speaks so well of our community that it's alive and well, and people are interested in coming together and helping each other out, which is awesome. So for that, if you want to just learn a little bit more about that and get enticed to become a member, just take a look at our calendar. It's on our website, cfha.net or integratedcareassociation.com. Either one will get you to the same website. And you can go to the events tab, and everything's going to be listed there. You get a sense of what we're up to. So yeah, that's our news and notes for today.
Thank you. Well, so to transition us into our topic, I have a story to tell, like I often do. It's been a rough month at my house. So if you're keeping track, you might remember that I'm getting married this summer, which is exciting and not the rough part, but does take a lot of time to get figured out. And my fiance partner is working nights this month. And so he is not here. Our routine is totally off. He's sleeping during the day and working at the night. And so that's off. And then on top of that, one of my kiddos had a health challenge. He had a really weird story where he failed an eye exam that led us to the optometrist or eye screening at school. And we went to the optometrist, and the optometrist noted some swelling in his optic nerve areas and sent us to ophthalmology. And the ophthalmologist ordered an MRI. And the MRI came up with all kinds of crazy things. And they're watching, and it led to a couple nights of hospital stay. And he was diagnosed with, he'd been totally asymptomatic, was diagnosed with a new health condition and has had to take a medicine for it. And he's going to be okay. All of they were working him up for some really scary things like CNS leukemia and demyelinating disorders and a lot of other things. And we're going to have to keep an eye on some things. But then he's been adjusting to a new medication that's been real hard on him. If he's upright for more than 30, 45 minutes, he gets a headache and nauseous. And so it's just been a rough month. And on top of that, guys, I got a couple jobs. I got, I have 3 other kids, and there's a lot going on, and I'm just feeling really tired. And our healthcare system is under a whole lot of threats. And it seems like there's news just about every day that gives me pause and makes me so grieved for our world and our society and our country. And so it's just a lot to hold. And I know that that is just my story and it's just one story, but I know it also represents so many other people. And so it made me think about, clinician well-being and team well-being, because when I'm struggling, that has an impact on my supervisees and on my learners and on my patients and, all of that impact. And so I was looking back, and the last time we had a conversation about well-being and burnout was in 2019. And we lived in a very different world in many ways in 2019. It was pre-pandemic, we'd never even thought of the words COVID-19 and stay at home and all of those, issues and all of the changes that's led to. In many ways, we weren't facing a lot of the same threats to our healthcare system and delivery and our jobs as we are now, and our patient care and all of the just really increased, existential threat and marginalization that's happening. And everything feels more complicated to me than it did in 2019. And even then, we had really high concerning levels of burnout among clinicians. And we were already starting to wonder, how do we do this well-being? How do we support teams and clinicians? So that's where I kind of want to open our conversation, and not necessarily that we're going to have all the answers, because we never do. But I do think that it might just be good to talk about how are things and how are we thinking about this and how are we moving through it. So that's a little bit about kind of how I've been thinking about it. I'm wondering if we can contextualize a little bit for each of you. How are you thinking about well-being these days? How are you doing? How has your thinking about it changed in the last 6 years, maybe since the last time? And neither one of you were here for that conversation because Jen hadn't joined our podcast yet. And I was just listening back, and Neftali was somewhere, I'm going to hope, on a fabulous vacation the month that we recorded that. So also, I'm curious to hear both of your thoughts in general.
Yeah, I think this is a timely topic, Grace, because if I'm being honest, I'm not doing too well right now. I think I hadn't realized how much of a toll, like in my job, I talk to a lot of people in healthcare all over the place. And there haven't been a lot of nice conversations. And so, I just consistently talk to people who are afraid for their jobs or other people's jobs, if they're working in the VA or if they're working on some sort of government-related contract type situation, or if they're an FQHC and they're concerned about losing funding of different kinds, or just feeling, even if you're not under threat, like there's a feeling sort of shackled, like you don't know what to do because you don't know what's coming next. So you don't even know how to plan for the thing that you don't know it's coming, but you don't want to do anything because you're concerned. So anyway, so all these conversations, like it's really hard to listen to these things and not have answers and not have great solutions and to worry about our association also. All of this has the potential of having downstream effects on us. We don't have any direct federal funding, but federal funding does a lot for our members. That allows them to become members or work with us on consulting projects or attend our conference, right? Or any of our many events. So there's that too. And I think there's a little bit of attrition that's sort of catching up with me at this point, where it's like, yeah, it's just, it gets to a place where you can get easily demoralized, right? And you just feel like, I just don't have the energy, right, to get it up again and go after it. And I think that's many of those same feelings are feelings that even if you're not in my particular role, if you're in healthcare, you know what that feeling feels like. You can be in your role, Grace. I've talked to many of your counterparts in the country, and you know, even without all this stuff related to the Trump administration, before that, there's a lot of healthcare organizations that don't do a good job of supporting, acknowledging, recognizing the work that you and your colleagues do, for example, right? And that's why we started that group, honestly, because it's like, hey, we got to get together and got to have a voice here, right? Because we're doing great work, but like, is it being recognized, right? So, so I think some of those feelings are very, they're things that, like you said, we've actually been feeling them for a while in healthcare, even pre-pandemic. But there is a confluence of so many of those things. We have that sort of those pre-existing conditions in healthcare. Then we had the pandemic. We had sort of a little bit of a respite there somewhere, although it doesn't feel like it was much of a respite. And now we've got this, right? So that to me is what this feeling kind of elicits. So, and I don't want to be a bummer to people listening today. I think there's reason to have hope and to keep waking up every morning. But that's honestly where I'm at today.
Yeah. Well,
Yeah.
I think I appreciate just the candidness that you shared that with, because I think that candor, that doesn't sound right. The candor,
We can make
because
up new words.
Yes,
people know
please
what
do.
is what is language anyway? We're always
Yes,
making up,
all
whatever.
relative.
Because I think, and yes, we will likely get to a message of hopefulness and meaning and purpose at the end of this podcast, because it's what we do and it's how we keep going. But
Hmm.
it's not to downplay or ignore the severity of everything that's going on, because I think it's important for us to not gloss over. It's a weird juxtaposition to hold all of that and normal life and happy things. Like, it's almost graduation season. Kids are going
Right.
to be finishing school and moving on and moving to new plans. Like I said, I'm planning a wedding, which is so wonderful and exciting.
Hmm.
And also, like, everything's on
Hmm.
fire. And so it's everything all at once.
Yeah.
How are you doing, Jen?
Yeah, struggling too. And, both of your points, struggling for a long time, especially from the physician community. Like, we're a bleak, crabby bunch, and we've been that way for ever, I think, pre-pandemic. There's been a lot of healthcare problems. And despite that, I think we're, showing up every day and we're not quitting. And that's what gives me hope, honestly, is things like CFHA. Like, hey, it's broken. But this idea, this group, this community is doing something to push back against the sadness and the hopelessness and the dysfunction. And even if that's all we got, that ain't nothing. So let's keep showing up for each other and keep talking and coming to meetings. That's what I've been doing. And that's been truly career saving for me. I don't know if I'd still be working in medicine were it not for integrated care, because, it is helping me see the good and the joy of, like, yeah, the world's on fire, and, who knows what tomorrow will bring with what we're allowed to do with immunizations. And oh, you could, list goes on with all the fear of how healthcare could change, probably not for the better in the coming weeks and months. But there are good things happening, and this is one of them. So I guess my not Pollyanna, is just, yes, things suck, but they've kind of always sucked, but not really, because what doesn't suck is showing up for each other and finding the small joys in the patient you sit with and seeing them get a little better, or that kid that's like, back in school after their anxiety, or that person that's not using opioids anymore and literally could have died with their last fentanyl exposure. That shit matters. And that gives me some oomph to keep trying. I don't know. Because, yeah, again, I can grab a bitch with the best of them, my physician colleagues. We're a cranky crew. But when we put that aside and get back to the values of like, why are you in this profession in the first place? That feels more genuine to be connecting with that value of celebrating the wins instead of the, everything's so, glass half empty. I don't know.
Yeah, I think it's interesting because, as my thinking about burnout has changed over time and the conversation has changed over time. So I've been working in this area, around like medical education for close to 15 years now. And even in that time, the conversation has shifted a lot from, well, first we were going to pretend like nobody was burned out. We're going to pretend like that's not a thing that happens, even though
Right.
when
Or
we
if it is,
look,
it's a you problem, right? Like it's
well,
not a
that's
systems
what's
problem.
coming next,
It must
right?
be
So
your deficiency and you're taking on too
yes.
much,
Yeah.
Grace.
So like first we're going to pretend like it's not a thing, even though there's super high rates of, substance abuse and
Mhm,
suicide
mhm,
and just like general bitterness and
mhm,
mad at the world among,
mhm.
healthcare providers. That was, phase one. Then we're going to pretend like, well, it's a personal problem.
Right.
Like you're burnout, you need to take better care of yourself. You're doing
Yeah.
something different. And then we have moved, and what I've really appreciated about the conversation is it has moved to more of an understanding of this is a system level problem. And when we're talking about burnout and we're talking about the impact on clinicians and on teams, it both can be protective. Like I love what you were naming about integrated care and the relationships and how protective that has been for you personally. But it also can be detrimental. Like when our systems are perpetuating power differentials, when they are not giving people what they need. Like you don't see a problem that's pervasive without there being a system level cause for it. And that's really important because then our interventions need to be system level interventions. And yet, the components of burnout are felt so individually. And so, when you think about it or when we measure burnout, a lot of times, one of the most commonly used inventories is that Maslow burnout inventory. And there's a few different components of it. And one of it is kind of like, are you tired and like, just not wanting to do your work? Another one is, are you feeling like burdened by everything going on and like you don't have control over your work? But there's a third protective arm of that, and it is how connected do you feel to meaning and purpose? But if we and so I think a lot of times the danger of the conversation of saying it's a systemic problem is that we can relinquish some of our personal agency that we do have to engage in things that can move the needle a little bit on our own well-being. And a lot of what causes burnout is out of our control. It's either, personal factors about our personal situation, our context, or it's system factors of things that like literally we don't have control of them. And that's what's contributing to our burnout when someone's like dictating our schedule or dictating our practice or dictating, all of those pieces. But there is that personal component of how are you connecting to meaning? How are you taking care of yourself in and out of work? How are you having good emotional boundaries? And, how are you connecting with relationship and community? And we can't be so finger pointy and naming the systemic things that are going on that we don't also take responsibility for the ways that we're engaging and trying to take care of ourselves. That's my soapbox that I get on a lot.
Yeah, and I think it's interesting because connecting to meaning and purpose is also not just an individual thing. We can also, and this is, I think, a lot of why CFHA exists, is to point the system to meaning and purpose, right? And it's interesting you said, Jen, I don't think I've ever asked myself that question. What would my life be like without CFHA? And this is not a commercial for CFHA, by the way. I just thought about that. I was like, because I've been a member of CFHA
Mhm,
since 2005, I think, something
mhm.
around there. And then obviously working here at CFHA for the last 8 years. I just had my 8-year anniversary actually. And I had never thought about that. But like, absolutely, I would be out of here like Belvedere. I mean, have this
Mhm,
community, right?
mhm,
And that's not just because it gives me a sense of meaning and purpose to connect with people around the country that are also fighting the good fight, trying to implement programs, trying to advocate within the institutions for resources, getting grants, building the research, supporting integrated care. It's not just that. It's that I feel like when the larger system feels as if it's fighting against me and our teams, our healthcare teams, from providing good care, I feel connected to a community that is helping orient the system towards greater meaning and towards greater purpose. And I think that's the power of coming together, right? It's the power of, you could say, the power of collective action. And it's not even like it's super, sometimes it's coordinated, right? Sometimes it's like we're all doing something together. But a lot of it's just like each of us doing our own little parts and then helping each other out as we go through our individual journeys with our healthcare institutions and providing ourselves the encouragement, the impetus to say, yeah, keep going, keep going. This is good. This is good. This is gonna, have some downstream effects sometime.
I love
Um,
if you're listening and not watching to us on YouTube, you can't see the gesture that Neftali is making. He's kind of pushing his hand towards the screen, and it's reminding me of this feeling of like hands on your back,
mhm.
like
mhm,
that pushing forward and that support of you're not
mm,
alone in all of
mm,
this. And that makes so much of a difference just to know there's someone with you.
mhm.
Yeah.
Literally, literally,
Mhm.
like, that's what it is. You have to have those people you can call on and sit with and ask questions and process with, like, "Well, this is hard. It's supposed to be hard. We all think it's hard. It's not a smooth, straight path."
Gosh,
Mm,
one of my favorite things to say to someone all the time in whatever circumstance is it's not hard because you're doing it wrong. It's just hard because it's hard.
Yeah, that's right.
mhm,
That's a great point. And
That is such a word of encouragement. Mm.
Yes. And I think that the other thing I think that's important to recognize about these moments is this was true during the pandemic, certainly. I think it's true now that sometimes these really hard points also can be, as exhausting as they are, can be helpful for deeper connection to meaning and purpose, actually, because you start asking more fundamental questions during these times of sort of crisis. And I do think we have some opportunities to actually ask some more fundamental questions right now. As off the wall as some of the new secretaries' thoughts are about autism and vaccines and things like that, the new HHS secretary is asking some more fundamental questions about, like, why is our healthcare system not doing a better job with managing chronic illnesses in the population? Why has our mortality not improved, despite being a very rich country with a very expensive health system?
mm,
And so those are opportunities that we can take to connect to, like, yeah, why are we doing this?
mhm.
What's the purpose of all this? Right?
Do you think we'll get there where it's a, "Aha, we need to invest more in primary care?" I mean, I hope that's where we're going with this. I don't know. Do we have faith that that's the to answer those questions of why are we such an unhealthy, wealthy country, right? Is it we don't invest enough in primary care structure and preventative efforts? I mean, I'm biased because I'm in primary care, so I'm like,
Yeah.
yes, that's
No, no,
clearly
no.
something we
Yeah.
need to do
I
more
mean,
of.
I think yeah, on some level, obviously it does matter that key decision makers get there, right? With asking those really core questions and getting to that fundamental understanding that we've underinvested in public health. We have underinvested in primary care. We have way overinvested in specialty medicine. We've kept our system fragmented. We've enabled that fragmentation. So it'd be great if those folks got there. But I think actually it matters more that we get there, that we understand, that we collectively do that because the transformation itself to move towards that is not a year or two transformation. It's something that it's going to not need to be sustained. So it'll need to be sustained beyond this administration.
Mm-hmm.
But I do think that something fundamental, again, I'm taking, despite my exhaustion, I'm taking a pretty optimistic standpoint. I feel like there is something fundamental happening, and it's happening with our financial system. And I think related to that, because I think it's large part interrelated, our healthcare system, where it is so obvious that we are spending money in all the wrong sorts of ways and not getting the outcomes that we need to have in healthcare, that I think it's going to force us to think very, very differently. And just to be tangible about that with folks out there, because I know these conversations can feel way out there. It's not all that complicated, but it does require deconstructing our systems. So it's the idea that if Jen and I are working together on a team, that the reimbursement system seamlessly reimburses the fact that we work together with a patient and their family on that day, right? That it's something that the system will pay for. They'll pay for that team-based care that happens on that day. The system makes it super hard to do something as simple as that.
They do.
Or you're caring for a mom and a child,
Mm-hmm.
their baby.
Mm-hmm.
The system makes it super hard to,
Mm-hmm.
if the visits for the baby,
Mm-hmm.
getting paid for the mom is not going to
Mm-hmm.
happen, even though the mom is the most important variable in that, right?
Mm-hmm. Mm-hmm.
But if the system were set up where it made it easier to care for a family unit as opposed to just an individual person or even an individual visit for that matter, right? If it's paying for the work that's being done to care and produce health,
Mm-hmm.
that's what makes sense. Or even just, I'll tell you a very timely story. This morning, my wife works in the emergency department, and she had a homeless person come in, and the homeless person was seen for a medical issue at one institution. That institution lost their stuff. So they must have thrown it away or what, but all their person's stuff. So the person had no shoes. They gave the homeless person flip-flops. The person had to walk about 8 hours to get to where they were going to. So then they developed something between their toes. They cut
Mm-hmm.
themselves in the toes and got an infection. So then they end up in the ED with my wife. So what that person needed was shoes, right?
Mm-hmm.
Top of the medical care, they needed shoes.
Mm-hmm.
They couldn't find a way to get the person shoes. So they had to send the homeless person away with flip-flops. What do you think is going to happen to that person? Right? And this is also a person with multiple morbidities, so unmanaged diabetes,
Mm-hmm.
psychiatric issues, et cetera.
Mm-hmm.
So the system makes it hard for us to do the stuff that actually leads to health, right?
Mm-hmm.
That's what we're talking about.
Mm-hmm.
It's not sort of more complicated than that. So those conversations connecting to, and that's what meaning is. Meaning is like, if I have someone who needs shoes and that's what's going to produce health in their life, I can do that.
Mm-hmm.
That's meaning.
Mm-hmm. Preaching to the choir. Yeah, I think it's the patient and the end user provider that needs a bigger voice and a bigger seat at the table of like, we see what's needed. We're doing it all day, every day, and our patients are telling us and screaming at us of, I need help with this. And as a system, we need to deconstruct and listen to them and rebuild in a way that gets that job done. Because you're right, the system is so broken that it is easy to feel burnt out and bitter with like it's never going to change. Who am I to help fix it? Because it's such a huge tide of, profit driven and fee for service that like who are we to try? But I think it's got to, I don't know. I mean, end of the day, I think it has to be us, both a system solution, but us solution too, that we have
Well,
to get involved and talk with our peers and make not just anti-burnout, but like, I don't know, again, pie in the sky, more of the like wellness culture of like, no, we're not, going to just sit by and let this burnout thing destroy us as a workforce. We have to make some changes, or else we're not going to be here tomorrow, and there won't be young people coming up the ranks of the workforce after us. So it's time to be uncomfortable, uncomfortable enough to make a change, right? Like that old, saying.
Yeah.
I love that. I love that this framing that you guys have given me today, because I do like the idea of like not focusing on burnout per se, but actually being pro meaning and pro purpose, right?
Yeah.
Because I think you're right, Grace, that there's things that are out of our control in that triad that Maslow proposes for his instrument. And the one we have control over, or some control over, is can we make meaning and purpose? And can we bring it into our work? Can we bring it into our systems? Can we orient our teams towards that meaning and purpose in
Because
ways
both
that,
of these things are true. I
yeah.
mean, it is true that what you said a minute ago, Neftali, that this is not a quick change. No one has a magic wand to wave to fix the system that's leading to burnout. And we aim for better and we look for better and we try to get better. But the only way it gets better is if we stay in it. And if we stay in it and keep affecting change, because I do think that advocacy is the antidote to despair. We have to be affecting change. We have to be engaging and using voices. But the only way we can do that is if we're still around to do it. And so both of these things are true. It's true that we need big changes. It's true that the system is contributing to burnout. And it's true that we have to find a way to live in the meantime. And we have to find a way, because also life doesn't stop. So, this is,
As your kid's situation
yes.
exemplifies, right? Yeah.
And this is, but in both ways, like life doesn't stop
Mm-hmm.
because we have personal things going on that layer on top of all of our professional challenges. But
Yeah.
also life doesn't stop in terms of like, you can't just put your head down and wait for 15 years when the system is better, even if you're contributing to that system getting better, because like, Mary Oliver, this is your one wild and wonderful life
Mm-hmm.
and it's going to be over.
Mm-hmm.
We're
And
just
feel the joy. Go enjoy that
yes,
wedding and go have fun
yes.
with the kids
We
despite
have to
this
find
moment. Yeah.
in the middle.
Yeah.
And I think a lot gets in the way of that, but we have to experience, we have to take breaths. We can't ignore everything that's happened. It's a privilege in a bad way. We use privilege to ignore things that are happening. We use privilege to like protect us from feeling the pain of marginalization and oppression when we are in a privileged position, which is the wrong way, to use that privilege. We've got to use it again for advocacy, for correcting imbalances in power, and for supporting and affecting change. And also sometimes we have to breathe and we have to look away and we have to connect with that joy. Yeah, kind of like I said at the beginning, I don't know that we have a lot of like perfect answers, but it's meaningful and it's important, I think, to not ignore that this is a part of the conversation that is happening, and that, it changes over time. But a lot of what we come back to, of meaning, of purpose, of being in nature, of being in community, those things are pretty persistent, pretty
Yeah, it's
eternal.
funny because I forget which one of you talked about, keeping people coming into the profession. So we're trying something new where we've been pretty frustrated with the workforce pipeline issues for a long time. We keep having to retrain people into working in teams because their base training doesn't do that. So we developed a pre-professional membership tier. It's free. And this is for undergrads and for late high school students, so juniors and seniors in high school. And so we're going to have an event in about a month or so just to help orient these folks to what a career in medicine and a career on integrated care teams looks like. And it's making me think about like, well, what do we tell the up and coming people coming in, right? I mean, I would hate
Right.
to listen to this conversation and be like, I'm not going into that.
Right. Cautionary tale. Do not do what I did. And it's not. But
It is not, no, because I mean, I love what I do. I
same.
love what it has given to my life.
Mm-hmm.
And there's a lot of brokenness to be
Mm-hmm.
dealt with.
Mm-hmm.
Yeah.
Mm-hmm. Yeah, I'm inspired. I think the pre-professional track's great. The next, some of the young people I've gotten the privilege to meet at some health fairs recently in my community, they're amazing and they're dedicated and they're going to shake things up. So it's going to be neat to get to help support them in their journey to affect what they can and get the baton and like, all right, well, here's how you found the world. What can you do to make it better? I'm excited to see where they're going to go with things. I think we got a really good, neat generation coming up, I guess.
I mean, if we're talking about things that give us hope too, right? Look for the helpers is Mr. Rogers'
Yeah,
favorite quote, and
right.
looking or famous quote. And so like looking around at so many inspiring people that I know that are doing incredible work. I was confronted with some social media grossness recently of people
Mm,
slandering
mm,
doctors and all the
mm,
talking points about them just
mm.
like, being paid to push medicines and all of these things. And it was like, yeah, I'm sure that you would not mind that check coming in if it were true, Jen. You could have
I'm
some
not
things to do
cashing
with
that
it.
check. I mean,
Yeah.
I don't know. Not saying I would, but like
Anyway,
I'm not seeing that money. I don't know. I don't know who
the
is.
ridiculousness was off the
So
charts.
yes,
But what it
yeah.
made me think of, and I use that as an opportunity. The reason why I saw it is because a former resident that I had trained was commenting on it in the social media. So it like came up in my, and I use that as an opportunity to reach out to him and a few other just people that I know that are practicing in our community that are doing such amazing work and just saying, hey, you know what? I'm really thankful for you. And I'm thankful for the work that you're doing. And I see you and I know that you are just compassionate and empathic and you are making a difference in our community. And so just thank you. And so looking for that opportunity to connect and to support, and because nothing is more inspiring to me or more hope giving than to look to all of the incredible, like brilliant, compassionate, kind people that I know that are working in medicine and in healthcare.
Yep.
Yeah, and if you're out there and you are one of those folks who has suspicion about healthcare professionals, let me just tell you that there's the healthcare professionals in your world are doing their best in this broken system. And it's really hard sometimes to not confuse the brokenness of the system with the people who are trying to live in that system and work in that system.
Mhm. Mhm.
And, obviously every profession is going to have their bad apples every once in a while, but I'll tell you,
Mhm.
you will not find you will not find better people than the people that work in healthcare just because it takes so much to do it. Personally, there's a lot of sacrifice involved. It is not an easy profession to be in. So if you're in it, it's because like Jen and I and Grace, like we really love what we do and we care about it. We're passionate about it. And if we participate in things that are uncomfortable, like a denial, an insurance denial, or bills that are coming to your house, and systems that are not communicating with one another, and you as a patient need to sort of straddle that communication or deal with the consequences of the lack of poor communication. Just remember that really it's more of a system thing than bad actors. We're trying to do our best.
Amen.
So, on a really, really practical standpoint, how are you making it through right now? Holding everything that we're holding and naming that it is a hard time. What's something that's helping you put your feet in front of the other?
Just
Um,
moments of connection, just like what we're doing here today. Just talking with people you respect and know and having a chance to vent about the things that are hard, but then not getting so stuck in the bitch fest, but like, and yet here's some good. Here's something we can put energy into and get involved in so that it doesn't feel so hopeless. Just doing that in all aspects of life, professionally, your personal life. Yeah, that's what's getting me through.
yeah, same. It's not too complicated, I think. It's simple stuff like I'm going swimming today. I need to
There you
reconnect
go.
with water and it'll help me get through the day. Obviously reconnecting with people, as Jen said, and just doing the simple things that help you to remember that what you're experiencing is likely not as much hopelessness as just tired. You're fatigued. And if you're a healthcare professional out there, you know what that means, right? I mean, it's easy to feel negative, easy to have negative thoughts when you're tired. But if you reframe the tired as, I've been doing some good work, and that good work has caused me to feel tired, then that really is a different reframe than I'm in a hopeless situation.
True. Mine, it's same as you guys, connecting, looking for those little moments of exceptions and light. And we do something with my learners a lot where we end our meetings talking about moments of hope and healing. And, it's easy to get in that kind of negative sentiment override or have that bias to like just seeing everything that's going wrong. And I think a lot of us that work in healthcare are kind of perfectionists. We have high standards. We want everything to turn out perfect. And so we can focus on all the negative, but to look for the good and look for those moments of healing, look for those moments of hope actively makes a big difference for me. Any final thoughts that either of you want to share before we close off for the month?
No, I'm grateful for this community. I think I know that's a silly thing for me to say in my role, but like my awareness of how important this community is to me through this podcast has been awakened. So thanks for that reminder for both of you.
Yeah. Same here. Yes, for sure.
Well, thank you both for this conversation today. Thank you to our listeners. We appreciate you being here with us, and we'll talk to you again next month.